Today, I am going to talk about one of the most common reason why people get vertigo, and that condition is called as BPPV, which means benign paroxysmal positional vertigo. If you who are someone who is suffering from vertigo, or if just all of a sudden starts feeling spinning experience, then this video is for you. Let's get started. Friends, benign paroxysmal positional vertigo in simple words is a sensation where you feel that you are spinning or is the world around you is spinning. In both the situation, the condition is vertigo. Now, as you have seen my previous videos, I have been explaining a lot about vertigo and different types of vestibular disorder, but BPPV is one which is the commonest of all. Now, why does it happen? What to be done for it? Let's discuss about that. Now, BPPV majorly happens due to a problem inside your internal ear organ, which is called as vestibular system or else vestibular organ. Now, I will not go into the details of the anatomy of this because it's really complex and very boring. But what I'll try to do is I'll try to explain it in a very simple way. Now, inside your ear, in this organ which is called as vestibular organ, there are something called as calcium systems. These calcium crystals move inside the ear in a tube-like structure which is called as semicircular canal. This tube-like structure also have fluid in which these crystals are floating. Now, for example, whenever I turn or tilt my neck towards one side, these crystals will slightly move and will give me the awareness and the sense that I have turned my neck to the left hand side in association with something called as hair cells, which are the nerve receptors which gives a sensation of movement or which sends the signal from the organ to the brain. Many times this calcium crystals gets dislodged. These dislodged crystals when go to the lowest part of the canal due to extreme movement like turning, like bending down or looking up. At that time, it will overstimulate the hair cells or nerve endings that are present in the deepest and the lowest layer of semicircular canal. Now, in this deepest and the lowest layer of semicircular canal is your balance nerve. The nerve that sends signal from your ear to the brain and give the approximation or information to the brain about your balance. Now, when this nerve gets overstimulated, your brain gets false sensation or false message of lack of balance, and that's where you feel vertigo. So, what's the solution? It's simple. We need to make sure that those dislodged crystals that are now in the lower part of the canal moves back again to its original position. That will give relief from your vertigo. So, what are the common symptoms that can come whenever this dislodgement of this crystal will happen? The number one symptom will be spinning sensation. You might feel that the world around you is spinning or else you are spinning around the world. It's very similar to the sensation that we feel when we play on a merry-go-round or in a giant wheel or any of the ride that involves a lot of rotatory movement. We feel some time to settle down. Same thing happens with an individual suffering from vertigo. Whenever he is moving around and there is a dislodgement of this crystal, they go down at the lower part of your ear canal and your balance nerve and gives the false sensation, and that's how he starts feeling the spinning sensation. This vertigo will last for around 1 minute to 5 minutes. Vertigo symptoms can be mild to severe also depending on how much stimulation is happening and how long these crystals to dislodge or go back to its original place. Now, the second problem that comes along with it is fear of fall. There is a constant fear of falling due to lack of balance. A lot of postural adjustment that your body try to do to protect yourself, and that's where your body starts training neck muscle, start holding yourself tight, and this start giving symptoms of headache, neck pain, body ache, etc. So all of a sudden, healthy starts feeling sick, weak, and feels pain in his musculoskeletal system. That's not all. Nausea is also one of the common symptoms associated with vertigo, especially benign paroxysmal positional vertigo. In severe condition, this individual with nausea can also end up vomiting. Now let's understand what we can do to solve this problem. The first thing that is most important here to do is diagnose in which ear the BPPV exists, and second, to do the dislodgement of that calcium crystal. To know which ear is the affected ear, there is one test which is called as disc hall pipe maneuver. This maneuver is majorly done in clinics with the help of physiotherapists, or else even you can test yourself by doing this practice. The second thing that can help a doctor to identify is your history, your medical examination, at the same time CT scan or MRI scan to identify or rule out the other causes. Now let's talk about the treatment or solution to this problem. The treatment is a maneuver which corrects the position or brings this dislodged crystals back to its original place, which is called as Epley's maneuver. When you do this process of Epley's maneuver, it's very important that you do a lot of breathing exercises, relaxation exercise, take care of your diet where you avoid sodium intake, drink plenty of fluids and keep your stomach a bit empty. That will help you to get the symptoms. Doing regular practice of this and taking care of your muscle relaxation and avoiding forceful jerky movements are the best way to prevent vertigo that's due to BPPV, which is benign paroxysmal positional vertigo. It takes sometimes time for an individual to diagnose and work on it, but once the diagnosis is clear, the solution is also clear, but it takes consistent practice. So I hope that you will be consistent when you identify you have got BPPV, and make sure that you do your practices on a regular basis. I hope you found this video helpful, and if you are someone who is experiencing BPPV and want help, you can reach out to us for the diagnosis, working towards it. BPPV requires multidisciplinary approach, and that's why I would also highly recommend to see an ENT doctor, a physician, a speech therapist, so that your other conditions can also be ruled out. On that note, I'll end this video here and I'll see you in another video. Thank you.